Welcome back in. We are here at St. Joseph's Candler. We're at the Imaging Center, and if you're just tuning in, boy, we have already learned a lot. Some of that, of course, from Dr. Jordan Dixon. We've asked her to return. We've got some more to discuss. Thanks for coming back with us.
Thank you for having me.
So you're a diagnostic radiologist specialist here at St. Joseph's Candler, and I want to talk a little bit more about diagnosing breast cancer. How have you seen that change over the years?
So the advancements in breast imaging are vast, and they are amazing. They're rapidly changing. We have gone from 2D mammography, which is still in use, but now we prefer, if possible, to get 3D mammography, also known as tomosynthesis. It provides us additional detail, where we can diagnose breast cancers much smaller and earlier, which obviously affords people the greater possibilities of treatment and even cure. In addition to mammography, the use of whole breast ultrasound is now recommended for patients, particularly patients with dense breasts, which is lots of women. So this is going to help find breast cancers which are smaller, earlier stage, and therefore they'll have more treatment options available to them. Also, most recently, we have breast MRI, which we use in supplement of mammograms, which remain the gold standard for breast cancer detection. So we use this breast MRI often staggered with mammography. So every 6 months, women of high risk or with dense breast tissue are getting some sort of breast imaging. So this, again, is going to find smaller, earlier cancers that are more treatable.
Wow, amazing. And how impactful for the patients to be able to begin treatment sooner, have better outcomes. One thing that is fascinating, and we didn't have to think about years ago, is COVID vaccines and how this plays a role into all of this that we're discussing here today, really, but specifically breast cancer. So women have began their series of COVID vaccines, and some of them have even experienced symptoms of breast cancer. Can you explain that?
Yes, so the COVID vaccine in particular, but all vaccines in general do have an immune response, and that's what we would like them to do because they're activating our body's natural immune responses so that we can generate a response if we were to encounter that disease in the future. So part of that disease and vaccination response is to get lymph nodes that are big, and those are most notably in the armpit. Patients are getting their vaccine in their arm, and so they'll get enlarged lymph nodes in that armpit, in that axilla, and those often go down over time, but that also can be a sign of breast cancer. So if a patient is feeling those enlarged lymph nodes, then they should go to their doctor and make sure that that truly is from the vaccine and not a sign of breast cancer. We've also noticed patients getting some thickened skin on their breast in that side that they got the vaccine, which should improve with time, but that also can be a sign of breast cancer as well. And so that should just be evaluated by their doctor, and their doctor may decide to do some breast imaging or to watch and do serial physical exams to make sure that that's improving over time.
Yeah, so I guess the lesson is really just if you feel like there is any concern, it's best to get it checked out.
Exactly.
Let's talk a little bit more about screening. And, mammography, it seems like, is still the best tool, but there's more to talk about here because there's been improvements. 3D mammogram, for example, has, really been a game changer. It seems like you have whole breast ultrasound. Let's talk about that because that must change your job incredibly.
It does indeed. So we always begin with screening mammography. That remains the gold standard for breast imaging. So that's how we start, and that's the only way to determine if a patient has dense breast tissue. That is not determined on physical exam or simply by patient's age. This is only determined by the radiologist, such as myself, on a mammogram. And so if a patient does have dense breast tissue, or if they're high risk for breast cancer based on their personal risk factors or their family history, then they may also qualify for additional supplemental screening with whole breast ultrasound. And so the mammograms, if a patient has dense breast tissue, the cancer shows up as white, and their dense breast tissue also shows up as white, and so there can be a camouflaging effect when women have dense breast tissue. So the addition of the supplemental ultrasound is crucial because the cancers will show up as black against white breast tissue, so it will help those cancers to stick out, and so that is how we find those smaller, earlier cancers.
That's amazing to me. And I'm supposed to go to break, but I really want to ask you if you can quickly talk to us about maybe some of the future technology that you see.
So in addition to mammography and ultrasound, the breast MRI really is on the cutting edge of breast imaging, and that really is helping us to find completely undetectable cancers not seen with mammograms or ultrasounds, and helping people to find these early cancers.
Technology, it's amazing. You all are great. This is St. Joseph's Candler, Dr. Jordan Dixon. We'll be right back.